talk on importance of managing cardiovascular risk factors. We all know there is a progression of type 2 diabetes from onset and it moves on to long-term complications including end-stage kidney disease or cardiovascular disease. Patients are faced with variety of diabetes-related complications like stroke, cognitive impairment, dementia, depression, diabetic retinopathy, coronary artery disease, heart failure, non-alcoholic fatty liver disease, non-alcoholic steatohepatitis, chronic kidney disease, and diabetic neuropathy or peripheral arterial disease. Patient-related complications affect multiple aspects of patient physiology like micro and macrovascular complications and non-classical complications like cognitive impairment, depression, and NAFLD. Cardiovascular risk is the leading cause of death in patients with diabetes, and we all know this that the Indian picture is very different than the Caucasian population. Indians are at the higher risk of CVD compared to other population, especially in getting because they have higher liver fat, higher waist to hip circumference ratio, higher triglyceride levels, and higher CRP. So atherosclerotic cardiovascular disease has higher prevalence in patients with type 2 diabetes, 27% risk of cardiac event. So you can imagine the cardiovascular disease because of any cause is almost 32%, atherosclerosis 29%, CAD is 21%, and angina, MI, again they are 10 to 15%, and even heart failure today is a very big problem in type 2 diabetes, which is close to 15 to 20%. Heart failure and LV dysfunctions are early and often undetected complications of type 2 diabetes. Many factors contribute to increased CV risk in type 2 diabetes, like insulin resistance, lipemia, like because of dyslipidemia, thrombosis, glycated hemoglobins leading because of hyperglycemia, hypertension, and genetic predisposition. All these are actually contributing to early atherosclerosis, diffuse atherosclerosis, and calcified difficult atherosclerosis. Look Ahead trial is one which actually suggested that weight loss responders have improved CV outcomes. And the responders lost at least 10% of their body weight in the first year of study, and the primary outcome was 21% lower CV death, non-fatal acute MI, non-fatal stroke, or admission to hospital for angina. And the secondary outcomes were 24% lower as above plus CABG, carotid endarterectomy, PCI, hospitalization for congestive heart failure, peripheral vascular disease, or total mortality. STENO2 diabetes is one very important landmark study. It shows improved survival with intensive versus conventional treatment in type 2 diabetes. It was the data were very robust. Death from CVD was reduced by 62%. The only thing is you need to have a multifactorial approach. This glycemia legacy is again very important. That what if HbA1c is not controlled early? Poor HbA1c control in first year of diagnosis increase the risk of CV risk in long term. And type 2 diabetes increases the risk of cardiovascular complication by more than 50%, 53% for unstable angina, 54% for myocardial infarction, 56% for increased risk of heart failure, and 72% increased risk of stroke. And incidence of cardiovascular events almost doubles as HbA1c increases more than 7%. Annual total healthcare cost for people with type 2 diabetes and cardiovascular disease are 4 times more than that people without diabetes. And this is further worsened with increased weight in type 2 diabetes because weight promotes cardiovascular disease via multiple mechanisms. Increased blood pressure, increased blood sugar, increased insulin resistance, increased blood lipids, and inflammation. So all these things contribute to early and severe atherosclerosis and thrombosis leading to MI, stroke, or PAD. Connections between type 2 diabetes, overweight, obesity, and cardiovascular disease is that inadequate glycemic control is seen in almost 77% of the people, overweight and obesity in 88%, and cardiovascular burden in more than 70%. And in type 2 diabetes, hypertension and dyslipidemia are more than 24% higher in those who are overweight and obese. So almost 50% of the people with obesity are at increased risk of coronary heart disease. This is very significant data. And overweight or obesity in type 2 diabetes is associated with an increased risk of acute coronary syndrome and even heart failure. So benefits of glycemic control and weight loss in cardiovascular disease is multiple, because towards greater weight loss and overall health improvement is seen, and that leads to reduction in hypertension and hyperglycemia, prevention of type 2 diabetes, NAFLD, PCOS, dyslipidemia, cardiovascular disease, urinary stress incontinence, and NASH. So you can imagine a plethora of problems are being reduced in patients who reduce almost 10 to 15% of body weight. Obstructive sleep apnea, gastroesophageal reflux disease, and osteoarthritis of knee are another problem. And there could be remission of type 2 diabetes, reduction of CV mortality, and HFpEF if you lose more than 15% of body weight. So, how do we modify cardiovascular risk in type 2 diabetes? By lifestyle modification, glycemic control, management of dyslipidemia, platelet inhibition, weight management, and anti inflammatory therapy. So, I thank you for your patient listening.